Welcome to Abika's YouTube channel on our series Ask a Doctor. Today we will talk about prostate cancer because November is Prostate Cancer Awareness Month, and this is an issue that is very personal to me because I have lost some family members to prostate cancer. And before we dive in, I want us to keep something in mind. According to World Health Organization, prostate cancer is the most common cancer among men globally, and we get about 1.4 million new cases annually from prostate cancer, and then that causes about 375,000 deaths each year. So that's a lot of life lost through prostate cancer. In Nigeria alone, it's actually the leading cancer among men, accounting for about 29% of male cancers. So as you can see, is a big problem in Nigeria. And research shows that 1 in 6 Nigerian men is actually at risk of developing prostate cancer in his lifetime. So to shed more light on this issue and also to educate us more on it, we have a very passionate family medicine specialist in the house today, Dr. Ndubisi Obinna. He's a specialist at Alex Ekweme Federal Teaching Hospital here in Abakaliki. And to talk to us more on prostate cancer, Dr. Ndubisi, welcome to Abike's YouTube channel.
Thank you very much.
Okay. So we talked about some statistics earlier, and based on our initial conversation, prostate cancer, you said, is one of the leading cancers in men. Well, before we dive in, could you please explain to us what prostate cancer is?
Okay. First of all, we need to know what the prostate is before we start talking about what prostate cancer is. Because most of the time, most people don't even know what we are talking about.
Yes.
Yes, prostate cancer is one of the major cause of death in men, especially cancers in men. Mm-hmm. Now, the prostate itself is an organ just below the bladder. Mm-hmm. In fact, most people in the olden days, they always think that it's just a protector of the bladder. In fact, I think it's even coined from that, the word prostate is coined from that meaning that it is a protector of the bladder.
Okay.
So that prostate is becoming a problem for us men again at this time. So the prostate can regenerate and then metastasize and cause problems for the male. It could go to the spine, it could seep to the lungs, it could seep to the brain.
So when you mean regenerate, that's the cancer that we're talking about.
Exactly. It can proliferate. Once the cells of those prostates loses their tendency to contain themselves and they start abnormally proliferating, it turns to a cancer. So, but before it gets there, it starts from somewhere. So prostate cancer is just like every other cancer, is more in male because we have the prostate.
Yes.
That is just the difference. Because there is no more difference between prostate cancer and even cervical cancer.
Yes.
So because they cause the same problem. The most important thing is that the cells of that particular organ or tissue or cell abnormally proliferates without control.
Yeah.
I think that's...
Yes. Okay, so, when we talk about cancer now, cancer has stages because you said with the proliferation, it has spread.
It has.
So can you walk us, before we get to the treatment option, can you walk us through the stages of this prostate cancer that we're talking about?
The prostate cancer most times starts with benign prostatic hyperplasia.
Okay.
And
benign
prostatic hyperplasia.
Okay.
That is where it always starts from.
Okay.
And then will now progress.
Okay.
For some people, it might stop at that benign prostatic hyperplasia. It might not progress to becoming a cancer. Like I say, cancer is when it starts having abnormal proliferation. But that benign prostatic hyperplasia can also give its own symptoms, just like prostate cancer. Most times urinary symptoms.
Okay.
So that's the reason why benign prostatic hyperplasia is even the major reason why most patients come to the hospital. The symptoms they develop. So some of them might be managing it, and it could even turn to a prostate cancer, and they can no longer bear it, and that is why they present late. So when they present with those benign prostatic hyperplasia, they come with urinary problems. For example, they can come with frequency, they can come with hesitance. Hesitance, frequency is like urinating
all
often.
the time, yes.
Then they come with hesitance. Hesitance is when they're about to urinate, they find it very difficult to start the urination. Poor streaming, difficult to pass urine. You will see that, okay, the normal speed at which the urine flows
Is no longer
is up
there.
to is up to 20 cc per minute or so. But you will see it dropping down to 15 or even 10.
So it keeps reducing.
It keeps
Because I
reducing.
remember with this one of my uncles that passed away from it. That's actually the reason why he went to the hospital.
Yeah.
When he said, "Okay, I have the urge to urinate, but I can't
cannot
urinate."
I still find it very difficult. And even if while I'm trying to urinate, it dribbles.
It dribbles, and he said, "I still
And then
feel
after urinating, I still feel something still left inside."
Yeah.
You understand? So that is the problem we are having. So when it now comes to cancer, it is different. The person will start complaining of back pain.
Yes.
The person will start complaining of blood in urine. The person will start complaining of even kidneys, the heart issues, the lung issues, depending on where the cancer must have metastasized.
Yeah, which stage
So,
they are on.
but if it is discovered early, it might still be small. The differentiations in those cells might still be small and still well confined within the prostate.
So that's where the importance of catching it early is, because it affects the treatment options.
Of course. If you don't do it that way, when you now catch it late, you will not like the treatment options that you have.
I know, and I know I don't like. I don't want. We have to talk about the treatment option, because I know as a physician, you don't want it to get to that point.
I wouldn't want to get to that level.
I know,
because at that point, you know where this patient is headed to.
Yes.
You know where this patient is very difficult. So most of the time, what you do is no longer trying to cure the disease or control the disease. What you are trying to do at that particular point in time is to manage the symptoms. So it's a very bad one.
Yeah. So you talked about it looks like screening is a very important thing right now. So I know in African culture, men don't like going to the hospital.
Yes.
But we're trying to change the narrative of that to say it's okay to come and get checked.
That is the reason why we need to keep encouraging our men. In fact, the women should try to support us in this one.
I think we do our fair share of it.
I don't think so, because we're not receiving a lot of them.
I know, I do.
They only come when I've not seen, for example, a 50-year-old man
50
coming to the hospital to tell me, okay, it's difficult to find. It's not that I've not seen. To tell you, okay, please, can you screen me for prostate?
So if someone that wants to come, let's say someone now that picks interest on this, I said, okay, I want to go and check myself. What age or at what stage should they start coming? And is it something that you just walk into the hospital and I said, okay, I want a prostate exam?
The truth is that the age is variable. It depends on what you know about the patient. So which means it's more of personalized. So for example, if a patient comes to me and tell me, my father died of prostate cancer, my uncle died of prostate cancer, even my brother,
so he has a family history already.
So you now know, okay, this guy is high risk.
Yes.
So for that kind of person, at least at the age of 40 to 50 years, should start screening for prostate cancer. Then, but when you have low risk, nothing, you've never heard about anything in such a family, you can start from 50 years and above. So that's it.
So let's go back on that treatment option. I know we don't like to talk about, but what kind of treatment options are available for prostate cancer? And then talk about how the early detection will affects the treatment.
Yes. The first of all, prostate cancer, once they come, you need to take a very good history
Okay.
from them. Look at the family history. After that, you do an examination.
So what type of examination are we
There
talking
is this
about?
examination we call a general examination first. In every examination we do, we start with the general examination because it will give out some things to you. What will it give out to you? Is this person chronically ill looking? Like the person is sick for a very long time? Is this person looking pale? Pale, that's blood level has gone down. Then you now go to the specific examination. Apart from the general examination, you still have to go to the different systems of the body. You understand? Because it could see to the liver. And you thought the liver is enlarged with multiple nodules or something like that. So you suspect that you must have gone to the liver. And this person might be complaining of back pain. Must have, it likes the spine. As in prostate cancer cells, they love the spine. So they will go straight to the back and then cause that very severe back pain for the patient. So musculoskeletal system is also involved. You still have to check
so
that.
it's like a holistic.
You just have to check everywhere because you can see it to any part of the body. It could go to the liver, through the blood, through the lymphatic channels, through the it can even local spreading. Local spreading, it could happen. So it has a way of moving around any part of the body.
So with all this testing now, there's something that just coming out of my head. Everybody always asking about when it comes to prostate. So where does the PSA testing stand in all of this?
I will still come to that. Before I come to the PSA, you still have to do a digital rectal examination first.
Okay, which is the one that
most people don't like it because what it means, digital rectal examination, DRE, what it means is use your digital rectal examination. So which means I will position my patient properly on the couch, and then with lubricants we'll be able to gently assess the prostate because once you put your hand through the rectum, through the anus to the rectum in front, you will likely touch the prostate. And once you touch the prostate, depending on the nature, what you're seeing, shrunken, hard, tender, what's the name again? The median sulcus, obliteration, and whatever, you can make diagnosis at that initial time that, yes, this particular person may have prostate cancer or benign prostatic hyperplasia. Now, when you make that diagnosis and this patient came with, probably urinary symptoms of those hesitance and things I mentioned initially, then you can now say, okay, this is likely to be a prostate cancer if the person has other problems like those back pain, not just the back pain, loss of appetite, loss of weight and stuff like that, weight loss. Then you start suspecting this could be malignancy. You write your prostate specific antigen. This is just one antigen produced by the prostate.
So there are many other ones.
There are many other ones.
So why is this one mostly popular?
Because it's a bit confined, not really confined to the prostate. There are some other, even the seminal vesicles can even produce the PSA too, but it's a bit confined towards that area of the prostate. You understand? So that is why we are using that PSA to check for the prostate. So
wow. So it's a whole lot of tests.
It's a whole lot of tests. It's not just the PSA you're doing. It's not just the PSA. You still have to do an ultrasound scan. You still have to even check the liver, the liver enzymes. You still have to do a chest X-ray. Did it sit to the lungs?
So now we know about the examination and all of that. Can you just walk us through maybe like few treatments options? Because I know when people hear about cancer, when you hear cancer, you talk about chemo. You hear chemotherapy, you hear radiation, and all of these things. And then there are other medications too. Which ones are available for treating prostate cancer?
At that initial time, especially when it is BPH, you can actually use a medical form of treatment, although it has some other side effects. We have the alpha blockers. Surprisingly, these alpha blockers, for example, prazosin, can as well affect your BP. Because they work on the alpha and the beta blockers. Beta blockers are the ones that bring down
The
the
BP.
BP. So you see, we can also cause hypertension for this patient. So, but most of the time we start, if it is asymptomatic, we can start watching the prostate. You understand? That's, you keep checking. You do the DRE, you check your DRE, you check your prostate specific antigen. Is it increasing? Is it just there?
Yeah, okay.
Every month, or probably in the next 2 months or 3 months, each visit you keep checking.
You keep checking. So you
And
can monitor
it's not
it for years.
progressing.
Okay.
So why
you
do you go further? You can just keep
just
watching.
leave it. Surgery. Is
Then when
surgery
you now
also an
start,
option?
when you start talking about surgery is when you have seen that it is progressing.
Okay.
You understand? So, but there are different surgeries that you can do. Okay. The types of surgeries could be minimal access surgery. It could be an open surgery.
Okay.
Now, the minimal access surgery this time around is just a tiny opening that you do. Very in a matter of seconds, the patient is out, and then the patient is okay, almost okay. But in open surgery, you understand, that's open prostatectomy. That one is more difficult.
Okay.
Then it consumes a lot of blood and stuff like that. Now, those are the two types of surgical options that you can do. Then you can also do a radical prostatectomy where you can remove almost everything. Like, for example, the seminal vesicles, you can remove them. The ejaculatory duct, you can remove them. You can even remove the lymph nodes that you feel that are being affected. So you can remove those ones. So these are the surgical options that you have.
And when you do a complete removal, are there side effects for the complete removal?
Of course, there are side effects to that. For example, if you do a complete removal, even sometimes in subtotal, that's you did not remove everything, you can have urinary incontinence. Even you can have erectile dysfunctions. You can have what they call retrograde ejaculation or dry ejaculation. That's the person will be trying to release, but the whole thing will be going back to the bladder.
Would that cause problems?
It has no much effect on the patient, but if fertility will become a problem already. So that's just the issue.
So that's why this treatment option, the best way not to get to that part is
prevention.
Prevention.
When you screen, you are trying to get that person at that early stage.
So you don't
it's still within the prostate. You have options, treatment options. You can take out the prostate. You can use medications. You can use what's the name again? Even radiotherapy. You can put a radioactive agent inside the prostate. You can do all those. So you have numerous options that you can use.
So screening, as we can see, is very important.
Screening is very essential. In fact, it's even the bedrock. Otherwise, you will go into managing of the symptoms, and then at the end, you know what will happen.
Yeah. So, as a family physician that works at the tertiary level, how do you feel, or what do you see happening at the primary health sector level when it comes to prostate cancer? Do you feel like it's something that should be incorporated at the primary sector level? Because I think that's our first line of defense. And in most rural communities, people don't, by the time people don't have access to health, health services. So, do you feel like that is something that needs to be incorporated?
Yes, the simple things matter. We can screen easily, even by our examination. Even with our examination, we can easily screen and suspect that this particular patient might be needing more investigations. Now, when it comes to the treatment, it's not the job of the primary healthcare center.
No. It's mostly screening and awareness.
So we have a job to do. Our job is early referral.
Early referral.
We need to, once we just suspect, we send, and they take up the treatment from there. And then other things that you can do is trying to, how do I put it? The patients that come to you, they might be coming to you for different issues. So you have an opportunity to tell the patient about prostate, especially if they're up to 45 to 50 years. You can tell the patient, okay, Oga, we we have something they call prostate cancer or benign prostatic hyperplasia. Please, we would like to screen you because this could happen if we don't screen you now. So we can use that opportunity to get them at that very early stage.
Wow, Doc, we've talked about a lot, but we don't have that much time to continue. And I know you have a lot that you can share with us, but I think you've really touched the basis of what we needed to know about prostate cancer. So we talked about the what prostate cancer is, what prostate is, and the age to get screened. And I think you said that age is it varies.
It varies.
It varies, but I think the general thing is from 40.
From 40
years, and then
from 40 years. It depends on whether the person is high risk or medium risk or low risk.
Thank you, Dr. Ndubisi, for sharing all these your vital thoughts.
Thank you.
But we want to elaborate that prostate cancer is not a death sentence, and early detection can save
Well,
life.
at the same time, if you come late,
It becomes,
already sentenced.
it becomes a death. Well, we're trying to encourage early detection. So please, let's work together through our communities, our families, and our healthcare providers to break the silence and encourage the men in our lives to get screened for prostate cancer. Thank you so much for coming.
Thank you, and I also encourage the ladies to help our men.
We will do our best.
No, but I'm not seeing the result. That's what I'm saying.
Continue to do. That's why we're doing this now, so that we can help pass the message along and encourage everybody to come.
Let me just agree. No problem.
Please like, subscribe, follow us on social media, Abicares Foundation. Our website is still the same, www.abicaresfoundation.org. Thank you. See you next time.